Can anemia stop you from having a period? We're going to talk about that today and all about iron deficiency anemia, how it relates to your period, how you know you have it, and what you can do about it. For the best information on reclaiming your hormone health, rebalancing your gut and hormone health, and rediscovering the magic of feeling well, hit the subscribe button and the bell notification to be notified when I post a new video every Friday. I'm Dr. Shelley Meyer. I'm a registered dietitian nutritionist, board-certified functional medicine physician, and family physician. And I post on this channel all about rebalancing your gut and your hormone health and getting everything to work smoothly together. And one of the things we focus on is PMS and your periods. And we also focus on men's health with their hormone health, and even perimenopause and menopause. So lately we've been focusing on PMS. So I wanted to progress into regulating your period, having a normal period. And we're going to focus on all different topics on making your cycle more regular and more balanced and helping you feel a balance throughout the month. So today we're focusing on iron deficiency anemia and how that can affect your periods and how your periods can affect your iron status. So can iron deficiency anemia cause you to miss a period? Yes, it can. The interesting thing is the actual period itself, when it's so heavy, is what can cause, one of the things that can cause iron deficiency anemia. So we're going to get into the details of that. So the causes of iron deficiency anemia, like I said, can be heavy periods, not enough iron in your diet. Sometimes we see it with vegetarians or people that don't absorb enough iron. Sometimes there may be a leaky gut problem where absorption's not good, and I talk a lot about that on this channel too. So I have lots of other videos that I will link some above and in a playlist down below in the description about leaky gut and a poor intestinal barrier, and that way you might not be absorbing your minerals, particularly your iron. So also toxins, I've seen that in my practice with the patients that I work with, that they will sometimes have a heavy toxin load and then their iron is getting used up with all those processes of detoxification, and they have low iron stores. So those are the main reasons that you would have an iron deficiency anemia. Either you're losing it through heavy bleeding, you're not absorbing it, you're not eating it, or a toxin is getting in your way. So let's talk next about symptoms and signs. What is the difference between symptoms and signs? Symptoms are what you come to your doctor and you say, I feel this, this, or that. Signs are what your doctor observes is going on in you, or thinks is going on in you from observing you doing a physical exam. So the symptoms of iron deficiency anemia include fatigue, some pretty extreme fatigue, often if it's a significant case, a headache, dizziness, irritability. I've also seen people sometimes say they have chest pain or cold hands and feet, and that their tongue is uncomfortable. So the signs that we see when you come into our office and we look at you and do a physical exam are pale mucosal tissue right here when we pull kind of the bottom eyelid down. Also pale here, pale skin overall. Like kind of cool skin, the cool extremities like we talked about before, brittle nails we can see. So you can also talk about that as a symptom, but it's a sign that we could observe as well, and an inflamed tongue. So how do we know if it's really the case, if that's really the case? Because some of those things that we just talked about, the fatigue, the dizziness, the cold hands and feet, could be thyroid. So if you're having any of those signs and an irregular or heavy period, that doesn't always mean you have iron deficiency anemia. You could have thyroid, hypothyroidism in particular. So you would want to be tested for that. And I have some videos on that you can check out too. But one way we look at this is through your blood test, or this is mainly the only way we confirm it is through blood tests. We look at serum iron, so just like your blood test iron, and serum ferritin, which is the protein that binds to iron when it's stored in your body. And then we also look at total iron binding capacity. These are all done through venous blood where we draw it out and send it to the labs. So our goals typically, we also look at a CBC, a complete blood count, where we're looking at your hemoglobin and hematocrit, because those two factors have to be off, the hemoglobin and the hematocrit, for us to really confirm that it's actually anemia. Now the iron could be low, the ferritin could be low, so you could have some iron deficiency, but to kind of cross that border over into anemia, that's when you see the low H and H. So we usually test in that way. Our goals typically in conventional medicine are we would diagnose an iron deficiency if you were on your ferritin, your storage form, less than 30, and an iron deficiency anemia typically if you're less than 10. It can vary with the actual serum iron, and then the H and H can vary to the hemoglobin hematocrit, male versus female. So, and there's different levels of it. So we will take all that into account. Now, what can we do to fix this? So first of all, we want to get the bleeding under control. So you want to talk to your doctor about that. Some conventional doctors will recommend birth control. That's not the first place I go, although I will prescribe it. I'm a physician, so I will do that if we need to. But there are certain supplements that I've talked about on this channel when it comes to estrogen dominance that can help with heavy bleeding. Sometimes there can be a progesterone deficiency that could potentially help. So we really need to dig deeper into your actual hormone levels dig deeper into asking you more questions before we know how to exactly fix that with hormonal manipulation. But we do definitely want to fix the heavy periods and stop them. Another thing to do is to add iron-rich foods. So beans, lentils, white beans, dark chocolate, spinach, tofu, sardines, and then kind of as you go down the line of higher to lower, we also have some red meat, which is maybe better absorbed in some people, because sometimes with the grains, like your iron-fortified grains or your spinach, that kind of thing, they can have some substances in them that will block your absorption of them. But a lot of times it balances each other out. So if you're eating a lot of those foods, you're typically going to have a decent level. Now, some people, like we said, can't absorb it as well as others. So then we want to work on your leaky gut. And you want to go to a functional medicine provider or a naturopath or somebody who works with leaky gut, SIBO, inflamed or bad permeability of your gut. And then when you, we often recommend an iron supplement. You want to look at different types. Iron bisglycinate or glycinate is one of my preferred options because it's doesn't lead to the constipation that some other forms of iron can. There's some other liquid irons that are good. You always want to take your iron with some vitamin C. So a vitamin C supplement or citrus or any of the vitamin C rich fruits, berries, those kind of things, some type of vitamin C. And if you're really deficient, I would take it with a vitamin C supplement. And I will link some of the recommendations down below of some of the iron formulations that I like and that I think are well absorbed. The other thing you'd want to do is look at your toxins with your functional medicine or naturopathic doctor or provider and see if you do carry a heavy toxin load, and that way you can work on removing those toxins, getting your absorption to be better, and getting your detox pathways working better so that you can get that iron into your system. So those are my tips on iron. And yes, iron deficiency anemia can cause you to lose your period, but having heavy periods can cause you to be iron deficient. So stay tuned to the channel and check out the PDF down below. I'm going to have all of the parameters that I use for testing iron deficiency and some of the recommended supplements and food sources. So check out the free PDF. I have many other PDFs on gut and hormone health that I'd love for you to check out. And join me next Friday when we talk more about gut and hormone health.